Well, hi, folks. We're at a beautiful school, St. Marcellus, and I want to thank the principal as well, Mr. Anible. Thank you. Again, this is one of the nicest schools I've ever seen. First and foremost, I want to thank again the principals, the staff, and the parents for their collective efforts to help our students learn safely. You've done an incredible job, and I'm so grateful to the teachers, the custodians, and the staff who've worked diligently to keep outbreaks to a minimum. There's a lot of hard work that goes into that, and our government has supported our schools with $1.3 billion in additional resources. Over the summer, we've developed the most comprehensive and robust back-to-school plan in the entire country. A plan that provides us even now with the flexibility to respond to the challenges we face with a second wave of COVID-19 in our communities. My friends, we're here today because the higher transmission rates in some communities pose a real risk. So we have to be even more vigilant than ever. That's why we provided $35 million back in October to support schools in Toronto, Peel, York, and Ottawa. We know schools in red control zones or higher need extra support to keep students and staff safe. This is funding to hire even more teachers, to allow for physical distancing, hire more custodians, to enhance cleaning in schools, increase remote learning supports for students. Over the past 2 weeks, we have moved Durham, Halton, Hamilton, and Waterloo into the red control level. We have their backs as well. Today, I can announce we're providing $13.6 million to provide extra support to school boards in these regions. That's $13.6 million more dollars, which will enable them to hire in between 135 to 175 additional teachers, or about 240 more custodians, or purchase over 27,000 tablets and laptops for their students. We're also further expanding testing in our schools today. We're launching voluntary testing for asymptomatic students in regions of the province which currently have a high number of active COVID-19 cases. This includes Toronto, Peel, York, and Ottawa. This will build on our work with school boards and local public health units to ensure that testing is made available to the schools and communities where they need it most. We've deployed over 625 public health nurses for schools, including 64 nurses right here in Peel Region. These nurses supported our schools in developing and implementing COVID-19 health and safety plans, which includes infection prevention and control surveillance and screening, and what to do in the event of an outbreak. They have also supported communication and engagement with parents and local school communities, as well as broader health care sector. Our nurses have been absolute champions. Minister Lecce will share more details in a moment about further supports for our schools, but I want to be clear, we will spare no expense to keep our students safely in school, because their success is our success. Thank you, and God bless the people of Ontario. Now I'll hand it over to the birthday boy, Minister Lecce.
Thank you, Premier. Good afternoon. It's good to be here at the Home of the Spirit. It's a beautiful school, a wonderful community, and a great staff. I really appreciate the welcome from the principal and the teachers. You guys are absolutely awesome, and we're so grateful for all that you're doing during the pandemic. As we approach the winter break in this school year, and according to the Chief Medical Officer of Health, Ontario schools remain safe. They remain safe even while we face increasing rates of community-based transmission. It is why we are taking action, including tougher measures to protect what matters most: our schools, our seniors, and the most vulnerable in our society, knowing full well that the risk within our schools reflects the risk within our community. Our plan has ensured that schools have stayed open and safe, and seeing those smiles on kids' faces only confirms that it is all worth the effort. Today, we're building upon our plan, as we have throughout this pandemic. We are launching targeted testing for asymptomatic students, educators, staff, and families in high-risk regions. We're providing additional funding to combat COVID-19 in schools in Durham, Halton, Hamilton, and Waterloo. We're providing stabilization funding to all school boards so that they can keep classroom sizes small, protect programming and supports for our kids. And on the first day back from the holiday break in January, all students will undergo a comprehensive COVID-19 refresher focused on the fundamentals of safety, from proper mask use, hand hygiene, distancing. I would also include a healthy emphasis on mental health and tips for our kids to look after their well-being. Finally, to ensure students remain engaged in quality, dynamic learning when they're self-isolating, quarantining at home perhaps, or even over the holidays, we're launching 2 new interactive learning portals that are aligned with the curriculum of Ontario, produced by Ontario educators in partnership with TVO and TFO. So to recap, we are expanding testing in schools. We're stabilizing and expanding funding to safeguard our kids. We're providing a refresher training on safety on the first day back in January. We're establishing learning portals in English and French developed by Ontario educators. We're taking further action to keep schools open and to keep them safe. I just want to conclude with a shout out to the frontline teachers and staff, all of whom have been working so hard to keep our schools safe, because we're acting together, adding new layers of protection every step of the way to decisively ensure schools remain safe, to ensure that schools remain open, and to ensure quality education throughout this pandemic. Thank you.
We'll go to the phone line for questions. First question, please.
First question comes from Jenny Ewan at Toronto Sun. Please go ahead.
How you doing, Jenny?
Hi, Premier. Thanks for taking my call.
Thank you.
I'm working on a story about a group of salons in Toronto. They have a hashtag campaign called Show Your Stats TO as a sign of unity and push back to health officials and politicians. And basically, it shows the number of people that have visited the salons since the last lockdown and the number of COVID cases, which are 0 from all the ones that have posted. So what would you say to salons that say, this is an unnecessary step for them, just given that they have been safe in training for infectious disease prevention for a number of years?
Yeah. Well, what I can tell you, last time I got my hair cut, there was a COVID outbreak right in the hairdressers after the fact, a couple of days after I had already been there. So it does affect all of us, and maybe that was the only one. But again, you have to be careful out there. I support all the small businesses. I really do. I'm pushing as hard as I can, but again, health and safety is the #1 priority for our society. And as soon as we start bending on that, having people out there in the community, there's going to be an issue. The numbers are going to go up, but I support them. Every argument they make, I'm not disagreeing with them. I'm really not disagreeing. So we're going to do everything we can. After 2 weeks, we're going to review it, and 2 weeks is coming up, so we'll review it on the health table and see what we can do.
Follow up?
Thank you. I'm also speaking with a man who is an essential caregiver and gets tested every week for COVID, and he lives on his own. His 93-year-old mother lives in a long-term care home, and he's afraid that this might be their last Christmas together. So he feels he should be allowed to take her to his place for Christmas Day and back. So what we're hearing is just people are using their own assessment and own sense of risk rather than what the government has mandated. Is that a concern for you? And what would you say to this man?
Well, I understand. I get it. I want to be with my family. He wants to be with his mother. It could be her last Christmas. I get it. But just imagine if everyone did that. It'd turn into a disaster in these long-term care homes. We're going to have to lock these down, and that's why I'm requiring every staff member, every visitor, every caregiver, even someone that comes and collects the garbage, they have to be tested. It's very simple. We cannot open these long-term care homes up to having them take their parents out and then bringing them back. It might be safe for him. There's no doubt. He might be safe. Pick your mom up, get tested, bring her back. But I can't say that for everyone. We have over 70,000 long-term care patients and residents in these homes. It'd turn into an absolute disaster if we just let the doors open. If anything, we got to lock it down even tighter. And that goes for my own mother-in-law. If Carla came home and said, "Oh, I want to bring my mom home," I'd say, "No, you can't. We just can't do it any longer." And so our goal is to make sure that that we get through this as quickly as possible. And there is light at the end of the tunnel with the vaccines out there, and hopefully we're going to get those sooner than later.
Next question.
Next question comes from Cynthia Milliken at City News. Please go ahead.
Hi, Cynthia.
Hello, Premier.
Hi.
I'm wondering if you can tell me, I mean, this announcement today kind of follows, not that I'm saying I'm responsible for it in any way, don't get me wrong, but I did find in crunching the data that 48% of schools had an outbreak, an active case, this week on that particular day, and the numbers were also quite high in Toronto and York Region.
Yep.
I'm wondering if you would consider doing the testing for teachers, a mandatory testing for teachers, maybe once a week, so that you would get a greater sense of what's happening in the school.
Here at St. Marcellinus, geez, I'm having a tongue twist name on that one, Marcellinus, they do an incredible job. The principal's doing an incredible job. I'm sure, you know, the teachers union, if they wanted it, we'd do it. I wouldn't have any problem, but I just don't think that's going to happen with them. I think for the safety of the kids, the teachers, if we can do rapid tests, I'd be all for it. I think the educators are so important. They've done an incredible job. I always come up here and say I support the teachers, support the principals, vice principal, custodians. They're all champions. Would you get that through the teachers union? I'm doubtful, but I'll pass this over to the Minister of Education.
Yeah, thank you, Cynthia, for the question. I think, obviously, if that's the advice of the public health and of the Chief Medical Officer of Health, we absolutely introduce it. What we are announcing today, for context for staff, is a program to launch asymptomatic targeted testing in high-risk regions, in the 4 highest-risk regions of the province, in Toronto, in Peel, in Ottawa, and in York. That is based on advice from the Chief Medical Officer of Health to help understand where the challenges are within schools that may have higher rates of positivity or within communities that have higher rates of transmission. This is another step, another layer of prevention to mitigate risk and to improve safety. And we've come far. As I said in my remarks, we're at the halfway point almost. And I think we're at, in Toronto, as you noted, you mentioned about the 580 schools, 584 schools at TDSB, for example. Of those schools that have cases, 70% have 1 case. And to contextualize for colleagues or for folks listening at home, 99.9% of students in TDSB, in the largest school board in the country, 250,000 kids, 99.9% are COVID-free. And I appreciate for each and every case that brings angst to a family, to parents, to the teacher. But we're doing something right. And when I say we, I think the Premier and very much myself are talking about the frontline staff who are working their backs off to keep these kids safe. And I want to continue to build that momentum, which is why testing can be provided not just for students, but for staff, for the teachers, as you mentioned, and for the families based on the public health unit's decision and determination. So we're giving them that flexibility. This program starts today and will, I think, make a big difference in our plan to keep schools open in 2021.
Follow-up?
Thank you. Premier, at 3 o'clock today, the latest modeling projections will be released. The last time we saw those numbers, it was 2 weeks ago, and they were quite alarming, indicating that we would be at over 6,500 cases potentially a day by mid-December. I'm sure you've seen those numbers. Can you give us any context on what we're about to see? Are you encouraged at all? Are you just as concerned? We seem to be kind of holding steady with these numbers right now. What are your thoughts on what is about to be unveiled?
Well, I'm concerned. You know, I'm still concerned. Concerned that the numbers are going to continue rising. But let's let the docs go out there and show the modeling. They can explain it better than I can. But we can't let our guard down for a second. We have to be vigilant, and we have to really focus on the areas that we see the outbreaks, be it in Peel and in Toronto and York. We have to knuckle down and get through this. It's absolutely critical. The people in those regions play a critical role. I know the mayor examples, Mayor Crombie, Mayor Brown, and Mayor Thompson in Peel Region. Man, they're doing an incredible job, incredible. They're bending over backwards trying to do everything. It's not their fault the numbers are going up. I can guarantee you that. They're working around the clock. The people have to follow the guidelines, and that's what's going to change the game here.
Next question.
Next question comes from Chris Rushoey at the Toronto Star. Please go ahead.
Hi, Chris.
Hi, thank you. Good afternoon. My questions are actually for Minister Lecce. Minister, you and the Premier announced asymptomatic school-based testing way back in August when you announced funding for the school-based nurses. We're now almost at the end of November, and I'm just wondering why it's taken so long to get this testing up and running in the provincial hotspots.
Well, we follow the direction and advice of the Chief Medical Officer of Health. We, as you know, forethought well in advance of the school year to have a program for asymptomatic testing. Now that testing capacity is enhanced, aligned with the Ministry of Health and the broader actions we're taking, from restrictions in York and Peel to elevating other public health units to the restrict or to the red zone. When you see all the actions we're taking, the goal is to make sure we reduce transmission. So we're following their lead. We're following their counsel and recommendation to Cabinet when to introduce this. We, of course, put aside funding, I believe roughly $23 million for this specific testing that was announced in the summer. We're now launching this for the next 4 weeks in those hotspot regions, targeted, working with public health. Now, as we respond to the second wave, in part, to add another layer of prevention in place, as we have done, Chris, throughout this entire pandemic, systematically building upon our plan, adding new investments. We just added $50 million in ventilation, additional monies flowing to make sure that we do whatever it takes to keep schools safe and to keep them open, which I think is an overwhelming societal imperative in this province, in this country. And we have 2 million kids in class. We stood up an online learning system in the midst of a pandemic supporting 500,000 kids. And for 1.5 million children, we have roughly 4 times less the rate of COVID transmission than Quebec, who has only 1 million children. We're doing something right. The plan that has been unveiled is working, but we believe, as we see the risk rising in our community, we cannot, hope for the best. We've got to act. We've got to continuously act, which is why this asymptomatic testing program targeted in those high-risk regions, plus more money, more resources, more distancing, more hiring, an additional 2,700 teachers, building upon that record to further support the safety of kids is our priority, and we'll keep doing this throughout the school year, as the Premier has said, to do whatever it takes to ensure schools are safe and open.
Follow-up?
Thank you. Yes, so one of the worst, if not the worst, hit school in terms of an outbreak was in Windsor. I'm just wondering if you're thinking of expanding the school-based testing. Is that something you're considering, given that not all the cases are in the Toronto and Peel and York areas?
99.85% of students in Windsor, Essex are COVID-free. I've spoken to the public health, the lead public health within Windsor, Essex, as well as all the school boards, public, Catholic, English, and French. My staff have daily meetings with the leadership of public health unit as well as school boards to make sure that we don't see any further transmission. In the context of this school, what I can tell you is that communication flowed directly to parents, that testing was deployed into the school voluntarily for all students and staff, as well as ongoing discussions, rather an immediate pivot for the kids to be learning online, which is important just to continue the learning experience. So right now, the next 4 weeks are targeting the highest risk regions. We're following the advice of public health. If they determine and provide a recommendation that it should be expanded or we should augment the list, of course, we will continue to follow that direction and implement it swiftly. We do believe that this program is going to just only further help protect schools. We want to make sure schools are open, and this will help us do that in January 2021 and beyond.
Next question.
Next question comes from Randy Rath at CHCH-TV. Please go ahead.
Hi, Randy.
Hi, Premier. Earlier today, Minister Elliott told me that she was shocked and very concerned to hear the Prime Minister say earlier this week that the federal government is still trying to procure vaccine on the international market. This is going, we no longer know how much or when we're going to get vaccines. The minister seems to have been misled by the federal authorities last this week. what do you think of this, and what are you going to say to the Prime Minister tonight in your conference call with him?
Well, I think not just myself, talking to the other premiers, we have a lot of questions to ask. When are we getting it? What are we getting? Because there's different vaccines. And, how much are we getting? 3 simple questions that we need answers for. When and how much and what type. And we even if we get dribs and drabs, that plays a critical role, and it depends on what vaccine we get, no matter if it's the minus 75 degree vaccine that we have to be storing it, or do we get another vaccine that doesn't need the minus 75? But we need to know when. This is going to be the largest logistical challenge that this country's ever seen in a generation, getting these out. We have General Hillier. He'll be out here tomorrow with me, and he wants to make sure he understands exactly when the vaccine's landing on our docks, and a plan, a proper plan from the federal government. So those are the questions that are going to be asked. We need answers because we have to start planning. It's absolutely critical. And the other thing is, the last thing we want to be, we can't be last in line around the world. Canada should be first in line, if anything. We can't have our U.S. Neighbors down in the States and everywhere else getting vaccines, and Canada's waiting 2-3 months as their economy starts taking off when they have the vaccine, and we're sitting back, twiddling our thumbs, wondering when we're going to get it. So we need some answers off the federal government. And hopefully by tonight they'll have some answers and a decisive plan when these are rolling out, because it makes a big difference of getting 100,000 one week, another 100,000, another 100,000. That's going to be a logistical nightmare. We'll deal with it, but let's get some answers.
Follow up?
The Prime Minister also said that we do not manufacture these vaccines in Canada. Is that an acceptable situation, considering the size of the pharmaceutical industry and the government supports that have gone to it recently?
Well, it's funny you ask that, because I don't believe that. I believe we have the capabilities of working on it, but just to confirm, I'm getting on the phone with life sciences companies, and we're going to ask them straight up. I heard that, yes, we would be able to produce it. So maybe someone gives us, maybe Pfizer is willing to give one of these pharmaceutical companies the formula, start producing it. If they're that backlogged and we're all sitting around for 3 months, we have the know-how. There's nothing we can't manufacture here. I'm telling you that right now. We have a massive pharmaceutical industry right here in Ontario. Why not? Why can't we do it? So that's the other area we have to focus on. It's like anything else. Saying we can't do it. Well, everyone thought we couldn't manufacture PPEs. That turned it around. I have all the confidence in the world in Ontario pharmaceutical companies. You give them the formula and they'll make it happen.
Last question.
Last question comes from Paula Lorigio at Canadian Press. Please go ahead.
Hi, Paula.
Hi, Premier. I want to ask you a bit more about the Auditor General's report. One of the kind of key criticisms was that the government was scrambling to create this new governance system after declaring a health emergency, and that delayed the response. So why couldn't you trust the existing provincial emergency response structure that was already there?
Well, again, I appreciate the Auditor General's comments on the healthcare. What I'd like to do, and we'll take it under consideration, what I'd like to see off the Auditor General, look for value for money. If there's any mistakes, value for money, I'm all open to new ideas. If they find savings, and I'll let the health experts deal with the health answers. And by the way, Dr. Williams and Minister of Health yesterday answered that pretty clearly. So if the Auditor General can give us the value for money areas, that's great. And the other thing I find very, very interesting, never in all the years I've been in politics and everyone else, when the Auditor General lays down a report, it's one report. It comes out. It doesn't come out in dribs, one, another one, dribs, and another one dribs. Like, well, what's that all about? I know what it's all about. Anyways, we'll move on. We'll take the advice, and we'll deal with any financial situations. And again, I want to reinforce it. I'll let the health experts deal with the health. I'll let the financial people deal with the finances.
Follow up?
I'm going to ask you about a different report today.
Sure.
The FAO put out a report that said that almost half of the province's hospitals are in a poor state of repair, way worse than any other infrastructure like roads and bridges. And it says the province hasn't actually set aside enough money to make those necessary repairs. Again, unlike for highways and bridges. So how do you explain that in a pandemic, our hospitals are in a terrible state and you're prioritizing roads over healthcare?
Well, that's just not accurate. It's just not accurate. We're putting more money into healthcare, more money into building new hospitals than any government in the history of this country, bar none. I believe it's close to $26 billion into new hospitals right around the province. So maybe we should sit down and have a chat with the person that put this report together and actually give them the facts and show them the money that we're putting involved in hospitals. Every hospital that comes to us, we try to do our best to support them, which we have. We're building more hospitals than any government in the history of Ontario. Simple, bar none. Numbers don't lie.
Thanks, everyone.
Thank you. Thank you.